Your child needs the COVID vaccination to keep them safe. During this unprecedented pandemic, kids are unfortunately impacted by COVID-19 just like adults. The fact that we have this vaccine is so incredibly exciting and important to be able to offer to this age group. This will allow us to decrease the spread of this infection, allow our kids to stay healthy, keep them out of the hospital, keep them in places that they need to be, such as school and activities. It will keep the families safer. It will be allowing these kids to get back to some sense of normalcy in their life, which has been so hard for them in this last year and a half. The COVID vaccine is incredibly safe and effective. We know this. It's been studied, it's been looked at by the CDC, the FDA, the AAP, the American Academy of Pediatrics highly recommends this for this age group. We know it's new, and that can scare some people. But we know it's been tested extensively. We trust vaccines. We know the science. This will keep your child at lower risk of getting COVID, of having symptoms, of being severely ill or needing hospitalization, and unfortunately, potentially dying from this severe infection. Side effects of this vaccine are typically like other vaccines, more of a local irritation, maybe some local redness, swelling, pain. They can have some more systemic side effects like fever, chills, maybe some body aches, headaches. Again, these are usually mild and don't last for very long. A lot of parents wonder about the fact that if their child has had a COVID infection, do they need a COVID vaccination? The answer is absolutely yes. The reason is that although your body does develop some immunity with the infection, we know that with the vaccination, you develop a higher level of immunity, and that vaccination can add to or augment the immune response that you've gotten from the infection. So absolutely yes, if your child has had the infection, we still recommend that they get vaccinated to add improved immunity and more long-lasting immunity for further infections from COVID. In addition to getting your child vaccinated for COVID, especially now when we're continuing to see this surge in Minnesota, it is incredibly important to continue to practice things that will also help us to add layers of protection. So this is continuing to have them mask in public areas, to continue to hand wash, continue to socially distance. So all of these things, we consider them as layers in terms of protecting your child against COVID infection.